everyone. Can everybody hear me okay? I was hoping only 3 of you would show up because I hate talking in front of people, and you came out in a large group, so thanks a lot. No, I'm just kidding. No, I'm super excited everybody's here today. Before we get started, small bragging moment. For those of you that know, I am the very proud mother of a little girl, Riley, who turned 17 yesterday. And I'll be leaving here this afternoon to go to the aquatic center to watch her swim in her swim regionals for Davidson County. So I'm very excited. We'll put them at the reception desk. Okay. If we run out of handouts, I was trying to be good on the paper situation. That's why they're very small, because I put 22 pages on 7. I'll have more at the front desk next week. You can grab a packet. Hi, Legacy Therapy.
Hi, Susie.
Oh.
Okay, you're going to need your own help.
I might.
So we're here today because Tanika and I were talking a couple months ago, and we were like, you know what, it probably wouldn't hurt to just do an annual sort of review of what our levels of care are. Y'all are pretty good. Some of you hide from us things that are going on, and we're not here today to belittle you. We're not here today to talk down to you. We're here today to simply have a conversation. Before we get started, too, I just want to turn your phones off. No, I'm just kidding. I'm just kidding. I will tell you today, February 4th, 2022, everything you see up here is the policy and procedure as of today. Might this all change next week? Of course it will. It's Friends Homes. But as of right now, this is how we do things. I'm not saying this is going to be set in stone forever, but this is how we operate right now. So, be diplomatic about that. All right, so, first slide. Turn it on. Are you kidding me? I just put new batteries in it. Hold on. All right, sorry, I'm not so great at this. First slide, independent living ADLs. As you all know, you signed up to live in independent living. You actually signed up to live in a continuing care community, and we promise to take care of you from now until and ever, through all levels of care. So to be in independent living, you must be independent with activities of daily living, such as bathing. Everyone's dressed today. No one's in here naked, so we know you can dress yourself. Grooming, toileting, transfers from sitting in a chair to standing, getting up from your bed to your chair, ambulating with or without appliances, and with eating. If you recognize a decline in yourself, and Kunkel liked how I put that, and you feel the need for some assistance, please reach out to either myself, the Independent Living Healthcare Coordinator, therapy. Let them know that you feel you may need some help. I think one misconception that we have around here is if you have a little decline, we're going to come in the cover of darkness and send you to another level of care. And that is not it at all. We are trying to provide you with the safest care while you're here. You should not be falling. What did I say? ADL? I'm sorry. ADLs are activities of daily living. Thank you, Pam. You should not be falling. If you trip over carpet in your room once, that's okay. If you're falling and we get a phone call that you fell on Friday, and we get a phone call that you fell on Sunday, and by Thursday that same week you fell again, there's a little bit of an issue there. What we're going to do, we're also going to monitor your emergency calls. We're not looking at them every day. We're just trying to make a mental record of what kind of assistance you need. If you do have a situation with falls, that's where we can get therapy involved and see what we can do to help you out there. In independent living. Some of you probably haven't seen this in a while. Those newer residents, we go over this with you at assessment. You must be criminally pre-screened and background checked by the facility for sexual abuse. So congratulations, you all passed. You must be tobacco free, which I don't think that's really even an issue anymore. And you must not actively be suffering from substance abuse. Oh, no, I won't say that. You must not have any firearms or weapons on the premises. That even includes like a decorative display of firearms. You must not be physically or verbally abusive to your neighbors, the staff, anybody, or self-neglectful. Now this includes med management. If you can't manage your medications, that's not good for you. If you forget you took them in the morning and you take the same thing, that's not going to be great for you. So this includes med management, messy apartments, missing meals. If we notice that you've had the same clothes on for a week and they're covered in food, that's gonna red flag us. The messy apartments, let me go back to that. There's messy, I live in messy, because I live in it. But then there's also messy. The deal with the apartments is let's say that I live in 305 and 405 has a leak. And so maintenance needs to come up and look in my apartment to see what happened. And you can't even open the door because it's so messy. And you tell maintenance, oh, I'm good, come back tomorrow. No, maintenance needs to get in there to provide care for your apartment. So messy is one thing. We're really talking about, I've walked into some apartments where the bugs are flying around, you can't walk through. I think I'm looking at everybody in here. I think y'all are all pretty good. And this is a tough one. You must not be suffering from active psychosis. There are days I think I'm suffering from active psychosis.
We know.
You must score a 12 or higher on a brief interview for mental status if living alone. I was going to have a picture of the test, but I thought y'all would study it and trick me later, so I'm not showing you what it looks like. It's super simple and it's super brief, and it just sort of gives us a baseline. If you score you want to get a 15 on it. I'll tell you that gives you an A+. If you score a 15 on it today, and Teresa comes to see you in 6 months, and you're like, you score a 7 on it, or you're seeing like pink bunnies on the top of Hobbs, firing water guns at you. We know that when we talked to you 6 months ago, you were good. Today, you're not good. There could be many reasons why you're not good, but we're going to look at that. I think if you have to have a deeper dive for a mental exam, your doctor has to order, am I correct in that? The mini mental status exam or the Allen cognitive test.
Susi, therapy. We can do it
Therapy can do that too.
without a doctor's order.
Without a doctor's order.
Not to be specific. Yeah.
What?
When doctors order that therapy is in, we can do those tests without a specific.
When doctors order therapy, this team can do those mini mental exams as well. Functional ADLs. We also look at what you can do when we assess you for move-in, how you function by yourself. You must be able to manage your housekeeping independently or with resident arranged or facility fee provided services. That means if you can call housekeeping and say, I'd like my apartment cleaned twice a week, you've just managed your household housekeeping. So that's good. If you cannot do that, and you've got that messy apartment we talked about, we're going to have a discussion. You must be able to conduct your own shopping and pay your own bills unless services are resident arranged. If your daughter calls Instacart for you and Harris Teeter delivers your groceries, you conducted your own shopping by a resident arranged service. Pay your own bills. A lot of people just tell their kid, take over. That's fine. But those are two things you have to do or have someone do them for you. You must be able to operate heat appliances safely. That's irons, that's microwaves, ovens, heating pads. Y'all also got some interesting stuff up there. What is that little thing? It's like one little pot. Hot plate. Anyway, yeah, you have to be able to use all those safely. You must be able to manage your own medications or have a resident arranged plan. They can also help you with med management. They're going to talk about that in a minute. You must be able to get from sitting to standing or from bed to chair without assist. That doesn't mean pop up if you have to, use something to help yourself get up. That's one thing. If you're having to call a nurse because you can't get out of bed, there's an issue. And you must be able to use a telephone. I know people think that's really crazy, but we need to know that if you're in the apartment, you can pick up a phone and call for help if you need it, or just call for pizza, whatever. Okay, in independent living, you must be able to manage your medication and treatments independently or with resident arranged services. This is what I want to talk about. I'm not calling anybody out because multiple people have done it. I'm going to use myself and Teresa as the examples because we're here. I go and have a cancerous growth removed from my back, dead center of my back. Doctor says you have to have that dressed for 3 weeks every day. And I'm like, I don't want to go pay the money to have that fixed. Teresa, she's my next door neighbor, will you come over and fix this, do this bandage on my back? We don't want that to happen. First of all, your neighbor is not a nurse. Your neighbor, possibly, some of you are in healthcare, but your neighbor may not know what they're looking at. You need to have a medical professional here looking at what is going on with your back for infection for 100 different reasons. Plus, your neighbor didn't sign up to be a caregiver here. Your neighbor signed up to live here just like the rest of you did. So don't put your neighbors in that situation. And the thing about you guys is, y'all are so sweet and you want to help everybody do everything. And we love it, but we hate it too. Because then we also, as a staff, don't know that so-and-so needs some help. And we're not here to take you from the cover of darkness from your apartment to another level of care. We are here to help you. And again, as I said earlier, as of February 4th, 2022, we are currently not a licensed or insured to provide medical services. These must be arranged through a home health or clinic. If you are in the apartment and you fall, you're going to call that number or hit your buzzer. You're going to have public safety and a nurse come up to see you. If you've fallen and hurt your wrist and you're like, well, look at it. We don't have x-rays here. We can't give you stitches here. We can't provide any of that for you. And we would rather you go out to the hospital and let someone see you, treat you properly. Even if nothing happened, we'd rather them look at you than we'll look at you, but we want to make sure that if you have an injury, it's properly taken care of. So that is why you cannot call the nurse for every little ache and pain, Band-Aid, anything like that. Most of you do not. And 9 times out of 10, if you're calling for a nurse, there's a major reason you called for that nurse. So just know the reason we can't provide that is you're actually putting the license of the nurses in jeopardy because we don't have a license to practice that.
Susie?
Yes, ma'am. Sir, ma'am.
Who's supposed to change the bandage on your back?
You would call the IL healthcare coordinator. I'm sorry. She said, who changes the bandages on your back? You would call your IL healthcare coordinator and you would tell them what you got going on. You're going to either bring down the bandages and stuff yourself or we can provide that. And she's going to help you. There will be a charge for that, correct? But that is who needs to help you. Yes, that's Tanika. Or for the next little bit, it's going to be Teresa Cruz. Companion services. We understand that if you have a surgery or an injury, and for a brief period of time, you may need somebody to come in and help you. That's fine. But if you need someone to come in 8 hours a day, every day of the week, in order for you to stay independent, we need to have a discussion about what we can do with next steps or possibly a higher level of care. Let's take a knee surgery. You have a knee surgery. You need some help just doing light housework, getting food to you, that sort of thing. Have a companion come in and do that for you. But we're looking at like 2 weeks top. Would y'all agree with? Couple weeks. You can't keep the companion there to do your laundry and run and get your lunch and do all of this stuff for you. Because when you signed up for independent living, you signed up to live independently. When you have this, you need a different level of care.
I think I don't really understand the logic
Someone doesn't understand the logic behind that. The logic behind that is this. If you need help bathing, dressing, fixing your meals, cleaning your house, all of those things, those are criteria for living in independent living. If you're having to have someone come in and provide all of that for you because you are not able to, we are here to provide you with that care in either assisted living or skilled nursing. Does that make sense? Yes.
One of the things I have heard is that I needed help immediately after a hospitalization, and I was put into skilled care. My family was told I would be there forever, to clean out my apartment. They did. They cleaned it out. Everything went. And then when I was well enough to go back to my apartment, there was no apartment and there were no things to go back to.
That is a great comment, and I'm glad you brought it up. She said that, let's say you had a fall and you were told you had to go to skilled, and then you were told that you would be in skilled forever, and you shut down your apartment here. I can honestly tell you I've worked here for 13 years and I've never seen that happen. The only time that has happened is if someone needs to go to skilled and maybe can't afford to hold on to the apartment and be in skilled. But normally we know when you leave the hospital or have an issue that you're going to need a certain amount of time for rehab, either in skilled or assisted living. It's always our goal, and I'll say this out loud in front of everybody, it's always our goal to get y'all back to where you were. That's what we're going for. That's why we have therapy here. We want you to be back in your apartment. And I will tell you this too, we are the biggest chance-giving facility I've ever seen. We will let you go back when you might not need to go back, but we want to give you that chance. If we see that you absolutely are not going to be able to do it, we start having conversations with you, with your family, with other disciplines that come in, and it's like a group decision. But it is not our practice to just, say, you need to go to skilled, close your apartment out. No, we have people that still have apartments 3 years after they move to skilled. I mean, we really do. So that is, I hate you heard that information because I think it's incorrect. But we don't do that.
Thank you.
Did I see another hand over here?
Yeah, but it's sort of the same thing. If you have knee surgery, that doesn't mean you're going to skilled nursing.
Correct. If you have knee surgery, we're going to know that you're going to need 3 weeks in skilled nursing. Okay, you're going to go over there, they're going to work really hard to get you back, and then we're going to start, we have a meeting every morning, and we talk about y'all. We talk about if you fail, we talk about your mom, no, I'm just kidding. We talk about everything, and there's always a plan. If I know Gail Warnicki fell and she's going to skilled, we're already looking at 3 weeks trying to figure out what we can do to get her back. Maybe it takes 5 weeks, but we're always looking at what we can do to get you back. I'm going to take a break, and I'm going to let therapy come up here and talk about what they can offer you to keep your independence in independent living. How excited y'all are.
Well, I guess first what I'll talk about is the process, because there is a process. And it's kind of in flux right now because I keep getting phone calls from certain doctors saying, have you started therapy with so-and-so? And I'm like, no, I never got an order. We have to work under a doctor's order. So if you go to your doctor or you happen to be Dr. Gupta and Mancy's, they will either give you an order or they will need to fax me or place an order in my box, so if you go to an outside doctor, they're going to need to fax an order or hand you a paper order. You will then need to call me if they hand it to you. Otherwise, I have no idea if you have an order.
I don't know your name.
Oh, sorry, I am Adrian. I am
PT?
with PT. I'm the physical therapist and the rehab director at Friends Homes Guilford. Sorry, I feel like everybody knows me because I've been here for 17 years, but lately I've had Dr. Gupta write orders, but she doesn't give the resident the order, and she doesn't give me the order, so I don't know anybody has an order, and then her office calls and said, well, have you started therapy with so-and-so? No, I didn't know they had an order. So she and I are working out a process. But 9 times out of 10, your doctor is going to give you an order. You then call us at this number, leave a message if we're not in there. I will call you back. It usually, sometimes it's the same day, sometimes it's the next day. Then I will ask you, okay, what's the order say? Who's your regular doctor, or who wrote the order? And then I will contact insurance or Gail Allen in the business office and get insurance approval, because some people have co-pays, and I like for you to know that up front. I like for you to know what you're getting into. Because some co-pays are $0, some co-pays are $40 or $50. And if I'm seeing you 3 times a week, that's $150 a week if it's $50 copay. So we try to work all that out beforehand so you are aware of what to expect. Once we have all that, then we can schedule an evaluation. Some insurances will only let us do an evaluation, and then we have to get approval or prior authorization for the treatment. So that takes a day, 2 days, 2 weeks. Just depends on the insurance. So that being said, it takes a little bit of time to get it started.
About last spring, I went to a therapist on the outside, and it was, of course, ordered through my doctor, and the insurance covered everything, and that was it. Good insurance, I have to say. But, I thought if we were no longer affiliated with Nancy or with Dr. Gupta, that you did go to an outside person. I didn't realize that we could come to you all for whatever services you have.
Yes, I think the question was, she didn't realize she could come to the therapy here having an outside doctor. Yes, you can. Probably more people have outside doctors than have Nancy or Dr. Gupta and come to us. We just have to get a copy of the order. Now, we may not always be in network with your insurance, whereas the outpatient clinic might be. But Gail will tell us that, and I will relay that message to you.
The other question related to this, suppose you need the help right away and you don't want to have to wait 2 or 3 weeks.
Then you certainly have the prerogative to go wherever you like. I mean, I had a lady just recently, we had to work through and find out, I couldn't get her doctor to write an order. We never could get a hold of him. You know, we went down the line. If I can't get your PCP, you've been to an orthopedic recently, we'll try them. I can't speed the process up. I wish I could. I wish I didn't have to work with a doctor's order, but I do. So, but you have the right to go wherever you like for your therapy. You know, I mean, I've had residents here who have home health come in because they've worked with them before. It's not my choice. It's not what I would like, but if they've had them before and they really like who they worked with, it's your choice to see whoever you want to see. That's independent living.
And they can come in here to render the service?
And they do. It's not often, but they do. No, and it isn't that often that it's 2 or 3 weeks. Now, I will tell you, I have to fax and fax and fax a lot of times to get orders, because doctors are not Johnny on the spot with signing things and getting them back. And trusting a fax machine on either end is not always effective either. I will tell you that. But as I said earlier, I am Adrienne. I am the physical therapist at Friends Homes Guilford. I've been here 17 years. I've been a PT for 20 years. I graduated from Elon with my master's. And physical therapy really focuses on balance, strength, lower body type things, walking, gait if you need an assistive device. Our goal is to keep you as mobile as possible and where you want to be as long as you want to be there. In general, for any of us, if you notice you're having declines, it's going to be a lot easier for us to help you and for you to kind of make those gains back to where you were if you let us know sooner than later. So if you think you're having some trouble, let us know. Because I'd much rather work with someone who's just starting to decline and we can make those gains back. Sometimes we don't always make it quite back to where you were before, but any questions for PT, and then we'll pass it to the occupational therapist.
Well, I'm Jenna Bradshaw. I'm the occupational therapist, and so I've been an OT for 8 years. I've been here for 4 years. So, with OT, I mean, we work on, well, all of us, but everything that Susie mentioned that is a requirement for you to remain at your level of care, so IL, we can help you with if you're having, a difficult time or a decline. I work on what she said, activities of daily living. We hone in on that more, and then I think you called them functional ADL, so the housekeeping, laundry, housekeeping, yep, cooking, thank you, and we can also work on pain, continence management, low vision. So we are your biggest, with everyone else, we are also your biggest advocates on getting back or remaining where you are. So if you need us, give us a call.
I'm Jennifer Mitchell. I'm the speech therapist here. I've been here.
We might hear you better if you come here, up here. Closer to the mic. I don't want to hear.
Okay, I'm Jennifer. That's better. I can hear myself now. I'm Jennifer Mitchell. I'm the speech therapist here. I've been here about 12 years, and I've been a therapist for about 25 years. And my role in helping y'all in I have kind of 3 main areas. I work on communication, which is the speech language part of speech language pathology. I don't have as much of that here or with you all as I do probably when someone gets to a lower level or a higher level of care. What I encounter more with people in the apartments is swallowing issues and cognitive changes. So with the swallowing, you may start to notice that you're clearing your throat a lot when you eat and drink, or you're having to wipe your nose every time you eat or drink. That's an excellent time to call me, because like Adrian said, if we start addressing that sooner and we have strengthening exercises and different tricks we can do to improve that, it's much easier to do sooner than later. And then also as far as the cognition, all of y'all, myself included, I mean, we're forgetting stuff. We're forgetting names, it's very common, but you know yourself, and you know if you're having trouble with stuff that you didn't used to have trouble with, or if you're having to kind of rely on your neighbors to remind you about stuff, or you are having trouble with your medications, remembering if you took something. Again, another good time to call me. Our goal is to keep you where you want to be, and I will work with you to set up the system that is reliable for you to maintain your cognition, get to the appointments and things that you want to do, take your medication correctly. Sometimes that can get complicated, but there are lots of things we can do to help you. So definitely call us. I know Adrian mentioned, some of the copays can be kind of high, but if we catch things early, and we can often set up home exercise programs to where, like if somebody's got a swallowing issue, I can train you on the exercises to do on your own, so that you're not having to pay for me to come 3 times a week. I might come once a week or once every 2 weeks to check and see how things are going, but y'all are actually doing the exercises on your own. And so I think PT and OT can do that too. So don't let that copay necessarily keep you from getting the therapy that you need. Because it's definitely a lot cheaper to do that and work with us and stay in your apartment than to get to the point where you are having to have the conversations about, a move. So, I guess that's it.
Um,
Go ahead, Matt.
I was just saying, I also wanted to mention how, and I think most of you know, we work with you through the levels of care. So speaking about a knee surgery, you have to go to skilled nursing. You're going to see us for therapy. We're working you towards getting back to your apartment. So when you're ready and we feel it's appropriate, we're going to start taking you back to the apartment and training you there and see how you're doing. Sometimes you have a short stop in assisted living to kind of, get that next step up, see how you're doing, and then ready to move back to the apartment. So just wanted to make sure, you guys knew that.
I don't remember what I was gonna say.
Okay.
You all visit us in our apartment, or do you have to come to you?
Yes, say it, repeat it. The question.
He asked if we can see you guys in your apartment, or do you have to come to us? And the answer is either way. If there's some reason we need to see you in the apartment, whether that's we're working on tasks in the apartment, or you cannot make it to us, we can see you in your apartment. Or you can come to our therapy room.
Where is us? Where are you located?
We are in the basement, so below Whittier.
Everybody know the
Does
tunnel?
does everyone know the tunnel? Okay, so if you come down the Henshaw elevator, kind of close to the fitness center, you're gonna go down the tunnel and take a right, and we're there.
We're not
And
easy
so
to
it might
find.
be that the first time we come and get you, or meet you at your apartment and walk you down or show you where we are located. We can work all that out.
Next to the Whittier Beauty Shop.
Next to the Whittier Beauty Shop, yes.
To see whether or not we could use occupational therapy or speech therapy, do we have to have a physician referral, or can you come ourselves?
So no, not necessarily. If you're interested, he asked if you just want to see if you need any of our services, do you have to have a doctor's order? And no, you could call us and say, I think I might need help with this, or will you come see? And we can do what we call a screen, and that does not take a doctor's order or cost anything. So, yes.
I did not get a copy of the handout. Are there extras here anywhere?
No, but Susie was going to put them at reception
Okay.
next week.
Thank you.
Any other questions? Okay.
Thank you very much. Another question? Yes.
Doctor's order versus private pay.
Doctor's order versus private pay. That's a question sometimes. Adrian's not paying
Oh,
attention.
sorry, I was answering a question.
Doctor's order versus private pay.
Okay, it's very individualized. So, I will go through insurance as long as I can. At some point, we kind of hit a plateau, we stop making progress, and I don't feel like insurance is going to continue to pay for it. So then we have a conversation about private pay. And that's one route of private pay. If you just want to continue therapy, but we don't think insurance is going to continue. Another route is, let's say we have somebody who just wants like a restorative program. You don't feel like you're not motivated enough to do your home exercise program on your own. You want us to come by once a week just to help you with it. That would be a private pay situation. Another private pay situation is your insurance doesn't cover you here. That would be a private pay situation. Yeah, either way, we always need a doctor's order to work under. And that's good, that way your doctor knows, what's going on. And another problem that I've run into recently is that a lot of times certain doctors, if they have not seen you in the last 6 months, are not going to sign an order just because you and I say you're having trouble with XYZ. They want to see you. Now, that's few and far between, but I know of one who is very much so like that. So, but we'll be here for I know I will at least be here until Susie's done talking. So if you have any questions, just raise your hand. So we'll be here.
Thanks.
Uh-huh.
Got my clicker to work. Real quick before we go over this, I want to introduce what y'all already know. I know a lot of you lately have been asking about Tanika. She's being pulled to help with nursing shortage in healthcare. So a lot of times she's working third shift, and then she's not here the day, during the day to help out. So I just wanted to reintroduce you to two individuals. We have Teresa Cruz and Taiwan Burney. Taiwan is the assisted living nurse manager, and Teresa Cruz, she does a little bit of everything. Can y'all stand there? Look at these beautiful faces. We are working on trying to eliminate the appointment in the clinic so you can just stop down. We're working on trying to have somebody physically in that room. If you need somebody, we noticed we were lacking in that area, so we are trying to fix it. They're both here, I swear to goodness, all the time. I don't know if they ever take off. If you can't find one of them, find me, find the receptionist. We can locate them. We keep a tracker on them. Just kidding, we don't. But anyway, I just kind of wanted to let you know we are wanting to sort of beef up the services you're getting down in that independent living nurse clinic. Is that fair to say? Okay. Any questions about that? Oh, the vigil system. I love the vigil system. The vigil system, independent living. We put a new system in probably 2 years ago now where we did Wi-Fi. This system is much better than the one we had before because you can live in apartment 407 and fall in Hobbs and we're going to find you. So that's a much better system. This system involves several pieces. You can order a pendant. This is the thing that hangs around your neck. I borrowed Velma Tomlin's, so don't let me keep it. This is the pendant. You wear it around your neck. You have an issue or a fall, you just simply hit a button. That's it. The problem with this is if you leave to go to Ruby Tuesdays, this is going to keep searching for a signal. It's going to run your battery down. So if you are leaving the premises, take it off because it's just going to keep searching for a signal. This one, we can replace the battery in. That's the good news. The second piece we have is the wristband. Unlike the ones before, the pendant is not waterproof. This one is water resistant. If your battery goes dead in this one, you have to buy another one. This is like sealed in the back, so we can't get to the battery. This one is $119. Your pendant is $109. One-time fee that you just pay once. One-time fee, unless your battery goes out in the wristband. We think they have about a 2 to 3 year shelf life, for lack of a better word. Not everybody has these. If you opted to have one, that is fantastic. If you do not have one, we would just like to recommend if you're going for a walk outside, if you're going on that forever long voyage to the therapy room, take a cell phone with you in case you have a fall or an emergency. You have some way to notify somebody that you have fallen or you're having a medical incident, something of that nature. We especially want you to do it if you're walking in the woods or around the facility. Somebody I even heard the other day said they carry a whistle with them, so if they have a problem. But they just don't work on the outside of the building. So be aware of that. Again, it's a one-time fee. Lynn would just add it to your bill. It would just be part of your next month's statement. Are you raising your hand?
I am raising my
What's up?
Who do you, say you want one, who do you have to get it through?
Can I tell you that right now? Okay. If you want one, I have the paperwork here today for you. What we do is this. We have you sign a piece of paper because I'm using her because she's walking out of my speech. Jane Pullen. Jane Poulin falls and her son goes, "Why didn't you help my mom?" "Well, she didn't want a pendant." "Well, you should have given her one." "Well, here's a piece of paper that we gave her with the information and she opted not to get it." Because you're signing if you want it, you're signing if you don't want it. So we do have these pieces of paper for that. And then I turn it in to public safety, and then they have to program everything. Right now we're out of pendants, but we're putting an order in. So it doesn't take that long to get them. It'll take a little bit to get them in, but it shouldn't take you that long to get it. The other part of the visual system is a daily check-in. That's also on this piece of paper. And I know this is a frustrating system. Some of you signed up to check in every day. That means between 6 a.m. and noon, when you're up and you're around, you hit that call box button, and it just lets public safety know, "Hey, I'm up, I'm good, have a great day." If they don't hear from you, they're supposed to start calling you, I think around 12:30, 1 o'clock. The problem I think I'm hearing that we're having is a lot of people check in, and then public safety calls and says, "You didn't check in." And they're like, "Yes, I did." So I cannot speak for public safety because I don't know the exact system they do, but I'm trying to keep a record of who wants it, who doesn't. I try to read those security reports to see, maybe somebody isn't checking in because they don't realize they signed up for it. So yes, Betty.
If you have pendant, are you still on the visual system?
Say that again.
If you have a pendant.
If you have a pendant, that just means if you have an incident, you can just press that button.
Yeah, but
If you're in the opt-out or opt-in system, you check in every day. If you want to, you can opt in to check in every day with public safety.
yeah, but do you have to use the visual system and the pendant?
No. If you want to check in every day, you're just hitting that call box. If you don't want to check in every day and you have an incident, you would just use your pendant. Or if you're in your room, you would pull, if you're able to, pull the emergency call system.
But you don't have to have a pendant just because you have a visual
No,
system.
the pendant and taking part of this, checking in every day, is totally optional. If you choose not to check in every day and you fall in your apartment and hit your call box, you're going to get help. It's the emergency call box system. Did I confuse everybody? I think I confused myself. Yeah? Yes?
Susie, I'm not quite sure that I understand about the pendant, about where it operates will work and where it won't. Is it just inside the building?
It is, and it should be everywhere in the building. Let me back up 1 second. Jack. He was walking by. Do these pendants, if they have a pendant in independent living and they're in skilled, does it pick up in there, or is it just the independent living part of campus?
I'm gonna go ask you, find out that question.
Okay, we're gonna hold off that. I do know in assisted living and skilled care, they have a different type of system. A lot of people, when you're in independent living and you move to assisted living, we take your pendant away because it just doesn't work in there because you're on a different type of system. There are Wi-Fi receivers all around though. Used to, you could only fall in your room or right outside of your room. Now you can fall anywhere. Yes, Jane, I'm glad you returned. She came back. Yay!
So it works even in the tunnel?
I think the only place we had issue with it not working was the fitness center.
It just depends. There's some, like Wi-Fi works a little bit this way down the tunnel and a little bit this way. There's like a dead zone for Wi-Fi in the tunnel. So if it works on Wi-Fi, I would not suggest falling in the tunnel.
So if you take away one thing today, we want you to know, be strategic in where you have a
Yes.
medical incident. Yes.
The push buttons
Uh-huh.
are a little tricky, and some folks may just need somebody to come over and you push that thing and the light that acknowledges your push is delayed.
Oh. Dottie has just told me that sometimes when you press that check-in button or the call system button, I guess a green light shows that, hey, I acknowledge that you pushed me. Sometimes there's a delay. You have to have a blue light, sorry, it's not green.
Blue light.
It's blue light.
You can push it and it will come on, and then a little bit later, sometimes you get a telephone call asking you if you did that. I religiously do that, and they told me that several people are having trouble and they're going to look into it. But I push it, it turns blue, and then they don't get to see me.
Well, feel secure that they're checking on it.
Arnie said that they were going to check on this, but you can hold it till it turns blue and let go, and then you will get a call, and if I'm not there, they will go into my apartment and check and see if I'm okay. And I'm not there because I'm somewhere.
Well, somebody said to me right before this meeting that they thought I did too much around here. Well, I'm gonna tell you what I don't do. I don't have anything to do with this visual system. I take your paper and I turn it in. I wish I could tell you a better answer for that. We've just had some glitches with it. I don't really know what else to say about that. But anyway, if you are not signed up to check in every day, you can take a piece of paper today. Yes, Jane?
I punch it twice,
Uh-huh.
and I don't get any problem with that.
Like you punch it and check in and nobody calls you?
Then it turns blue, and I punch it and it goes off. I punch it again, and it turns blue and goes off.
And nobody checks on you? Perfect.
Unless I don't check it at all.
And Jane successfully worked the vigil system. Congratulations. What you got, Jack?
That is wireless, that is hardwired, so no.
Okay, so if you go into assisted living or skilled, that pendant will not work. But the good news, if you go into independent living or, assisted living or skilled nursing, there's a lot of people around. They're going to see if you're having an issue, or you can go to them. So again, we do keep up with your signed paperwork. You can get that through me or reception. Now, we're just going to sort of briefly go over this because I just want to sort of show you what qualifies you for assisted living. Assisted living, which is Fry Hall, which is a wonderful place to be. I worked there for 7 years, and I miss it almost daily. It's a very cool place to be. A lot of fun. You move to assisted living if you need some assistance, some assistance with bathing, dressing, and grooming. You must not need assistance with late loss activities of daily living, such as incontinence, ambulation assistance, transfer from sitting to standing, bed mobility, and eating. Because if you need help with that, you need to be in skilled care. You should not be falling with a recent history of major falls. And major falls, if you're falling every day, that's an issue. Major falls to me, though, involve some sort of injury. I trip all the time. Like, it's ridiculous. I wouldn't call that a major fall. It's going to be one day, and it's going to be bad. Any questions on the Fry Hall criteria? The nursing type care you would need for assisted living, you may receive assistance with medication management and some light treatments. In fact, with a doctor's order, I'm looking at Taiwan, with a doctor's order and a little, we'll call it a skills test, you are able to give your own self-medication under certain circumstances if you go to Fry Hall. So that's actually a plus. You must not need a nurse to provide, hold on, I didn't read that right. Resident must not need nurse-provided resident assessment instrument defined daily skilled nursing care. Huh. If you need diabetic care, if you need oxygen or nebulizers, if you have a daily wound care that you need done, if you have IVs or a tube feeding, or assessment of an ongoing medical need, unless it's temporary, they do that in skilled nursing, not assisted living. Any questions there? Residents can have private duty companion services only. If a resident in assisted living is receiving private home health services, it must be for a finite amount of time, very much like independent living, for a specific service as approved by the interdisciplinary care plan team. That is going to be your AL nurse, that is going to be your social worker in assisted living. That could be Dr. Gupta. And like I said, that's a companion service. That's just somebody coming in to sort of just visit with you, maybe check your mail, like stuff like that. The one negative about having companions and nursing care that we found in COVID is when we can't have visitors in, you can't have these people come in anymore. So another reason why in independent living, if you're dependent on that to stay independent and a situation like COVID were to happen, you don't have that help. Fry assisted living. Residents who otherwise meet the assisted activities of daily living guidelines, but maybe have some dementia needs, will be screened by the interdisciplinary care plan team to determine if they are appropriate for assisted living level of care or if they require skilled nursing. The criteria includes exit seeking, wandering, or wandering without a purpose. How many of y'all have seen people like that walking around? And you know what? I told you we give a lot of chances. They love it. We let them walk around, and then there just sort of hits a point where we go, you know what? It's just not safe anymore. We try to keep them in their place as long as we possibly can. There's that brief interview for mental status. That score is going to determine what kind of cognitive impairment and what level, moderate or severe. Inappropriate or repetitive behaviors, hallucinations or delusions, and you got to score below a 10 for some dementia needs. And we're going to talk about that now. In Fry Assisted Living, the lower 800 floor is called Redwoods. We have identified that that should be a hall for people with a little more need for cognitive or dementia type care. They have a separate sort of set of activities to do. Maybe it's geared a little differently for them. They have scored below 10 on a brief interview for mental status. Is it still a separate dining room? Okay, they have a separate dining room. And that is just really, sometimes with cognition, this is not, I'm just making this up off the cuff. I'm so professional. When we leave you in an environment where there's all this stuff to do, like it almost overwhelms you and makes it, I've seen, like make it worse. If we sort of like shrink your world a little bit, there's a little bit more enjoyment. The things you're doing is more purposeful. And, you know, instead of having all of this building to roam, if that makes any sense. And then above the 900 floor is the hall called Sycamore. Residents participate in programs and groups offered in here. Really anything on the campus they're able to do, unless there's a safety issue or a behavior issue identified. Fry Hall actually has a representative that sits on the resident council, which we have found to be very beneficial. They report on the activities of Fry Hall and also have a voice for that hall on the campus. So it's actually been very helpful. The only thing that we don't really do in Fry are trips and outings. Don't normally do those with the independent living residents, primarily because now occasionally we do, somebody will qualify to do that, but a lot of times the independent living residents, you're having to walk a long distance, you're having to, you know, count your own money to pay for lunch. Just, we don't always have people in assisted living that can do that. But they do have a wonderful activity director, Emil Hendricks, who does provide outings and programs for them as well. We're going to be real brief with this. Whittier Skilled Nursing, you may receive assistance with any or all activities of daily living. You need help with everything. And that's okay. That's what they're here to do. You will receive assistance with your medication and treatments if determined by your plan of care. They'll do tube feeding, IVs, wound management, dialysis, diabetic care, oxygen, and respiratory treatments. The interdisciplinary team can refuse to accept somebody because sometimes we cannot meet the needs. What is that big thing we don't meet the needs with? Like, as far as, I've drawn a blank, I can't even ask you. Like, trait care. There's some things we just, well, there's very little, but. Again, with therapy, you'll receive services for therapy. They said this already, for therapy or restorative nursing if determined by your plan of care. Their therapy can be inpatient. I'll let you read all that. It's in your handout. The Birch's Dementia Household, that is the facility here. That's our 12-bed unit, locked unit, and that's for people on campus that really have a much higher level of dementia. You're going to score less than a 9 on a mini-mental. That's separate programming. It's a great place if you've never been back there. I love memory care. It's just a really neat place. The staffing is usually a little more regular, so they're familiar with what's going on back there. And like I said, it's just a cool place. Uh-huh.
Will the care for the people like this, I'll be here still, or with the new buildings, will they have that at West also?
Yeah, we'll still have the dementia care, like the locked unit type stuff. It'll still be the same 3 levels of care, even when we open up, and I'm glad you brought that up. She actually didn't make it today, I don't think, but Linda Bradshaw is my counterpart at Friends Homes West, and I wanted to introduce her today because we've been doing this, but again, we're talking about like this is a little bit new and it's really not. We are one campus. Friends Homes West is still Friends Homes. So if you, and I want you all to hear this too, if you're in your apartment and you have a fall, and we're full in Whittier, and you need a skilled bed, we have the option to call over to West and see if they have a bed. Several of you in here may have had to use that service before. You're not staying over there forever, but we have a skilled bed for you, and you don't have to end up going to a completely different facility. We're trying to avoid that altogether. So we do have that option campus-wide. That even goes for assisted living as well. We do have the resource, and West does the same thing with us. If they're full and we have beds available, we have multiple people that lived at West that are actually residents here. So, any other questions?
What are services on the weekends?
Meaning, like nursing services?
If I fall in my apartment.
If you fall in your apartment, you're gonna hit that button. We're gonna hit that pendant. Public safety is going to be dispersed is not the name, is not the word I'm thinking of. Public safety will dispatch, thank you, and a nurse will come with them. More than likely, if you have fallen and cut your head, we're going to provide first aid care, stopping the bleeding, putting a bandage on it. But she may look at you and go, I don't like the way that looks. It is my preference that I call 911 and you go to the hospital. You can say, sure, that'd be great. You can also say, I don't want to do it. So in that case, you will stay in your apartment, and then there's going to be follow-up with you to make sure that everything is okay. The nurse that comes to see you could be Taiwan, it could be a nurse from Whittier, it could be anybody. It's sort of the nurse that's on call. We don't have the nurse here for independent living over the weekend, but you will get help.
If I'm discharged from the hospital on the weekend and I need more than independent living.
Hopefully, someone from independent living, usually your independent living healthcare coordinator, is going to know this because they're in contact with the hospitals. If we know you're coming back on a Saturday, that's not our favorite day for people to come back. We hate coming back on Fridays and Saturdays just because there is a difference in the staffing. But somebody should be in contact so we know that you're coming in. There's constant communication with the hospital. Not always the best communication, but communication. Yes, Jane?
I don't understand the difference in what the nurses here can do, because I thought that you said that they couldn't do anything, but then you just said that if you fall and have a cut, they can put a bandage on you and...
That's how it's always been. If you call, they're going to provide first aid. They're not going to let you bleed out in your floor. They're going to provide aid for you. But, as I said earlier, if you need stitches, we don't do that here. we're not gonna leave you in the apartment with a open head wound when you need to be sent out somewhere. We can provide minimal assistance. Even if, you know, you get a nurse from any part of the campus, they're gonna assess that immediate need. If a Band-Aid covers it up, you feel fine. But if they come to see you, it's open, it's bleeding, you don't know your name, you're leaving. You're going to the hospital. Because that's the best plan of care for you at that time.
I just didn't think they could do anything. Except look at it.
There have been mixed signals, as I said earlier. We're trying to beef up some of the stuff we're doing. We're not going to leave you to suffer. Please know that. You were going to say something.
I was gonna just say, to answer the question, her question, he was asking about if something was to happen over the weekend and you came back. Whoever's here on that Monday will come up and do a wellness check just to make sure you're okay and see if you need to carry out any orders.
Well, and I think the hospital too kind of says they are safe to go back to their apartment, or they need assisted living, or they need skilled nursing. The hospital kind of puts their input in on that as well to get you to the right place too.
I'm glad you said that, because you are correct. We're going off the question here, what happens if you have an incident over the weekend and you've been in the hospital? And like Adrian said, if the hospital feels like you need a higher level of care, that's what they're going to recommend, and that's where we'll try to put you. If you go back to your apartment, you're going to have a follow-up Monday morning that there was an issue, and you're going to come get a wellness check. Yes.
4 years ago, I had foot surgery and came back to my apartment, but had to have a dressing changed every day.
Mhm.
And at that time, the independent living nurse came to me every day, changed the dressing, took my blood pressure. If I had that same surgery and same need today, would I have that service by the independent living nurse? Would she be able to come to my apartment, change the dressing every day for no fee?
No, you would have to come down to the nurse. I will tell you, the reason we're being a little stickler on this is we were practicing stuff here years ago. I was here when we were doing it, that we really shouldn't have been in independent living. And I'll just say it, we all got a little spoiled with it. And so to change all of that up, it looks like we don't care, and we care very much about you. It's just, if you're doing something without that license, it just jeopardizes who's working here. And it seems very unfair, but when it was brought to our attention that we were not doing that and following proper protocols, we're trying to make that better. And it looks like it's worse, but we're really trying to make it better.
Is there a plan to get
Yeah,
a home
could you
health license?
spell out for us what we could not have done by the independent living nurse in our apartments?
She wanted me to spell out what cannot be done in the apartment by the independent living nurse. You can come down to the independent living nurse for any need you have. Am I correct in that statement? There may be a charge for that. There may not be. Depends on... Let Teresa speak on this.
Hi. First of all, if I have to come to your apartment and you can't come to me, then you don't need to be an independent living. But you can come to me without an appointment for any need that you have. I will address it and make sure you get the appropriate care. Okay?
Did you hear about?
I did.
Is there any future plan to?
If you didn't hear my spiel first, February 4th, we're
Okay.
operating this, yeah, I mean, we're looking into it. I do think that a home health, Arnie's gonna kill me for speaking in a turn. I think,
Sorry.
but he's not even here, so it's my show. Just kidding. I do think we were gonna take a really hard look at a home health care license probably about the time that COVID hit, and it really just fell to the back burner. And that's, I think I forget where I was even this week where we talked about that, where we are looking sort of at the processes, because I do know that Health and Wellness has recommended that we start that process and looking into it. And it definitely is worth a look. But like Arnie told us at Resident Board, it's no cost to us, that will be a cost to you. So there's just a lot of stuff we have to look at. But yes, We do feel it's important, but we just have to weigh the pros and cons of everything. Yes, Nancy?
Are you saying that, Tamika, we don't have to have appointments anymore to get blood pressure taken?
Correct. You can just stop by during those clinic hours. 10 to 12, Mondays and Fridays. Sorry. You do no longer have to have an appointment for the IL clinic on Mondays and Fridays. From 10 to 12, that clinic is open, and you are more than welcome to come down and have a need met. Yes?
Is that all we can do is blood pressure? Sometimes you have some minor things,
Whatever it is you need.
whatever.
Whatever you need, you can come down without an appointment.
Yes.
Without an appointment,
Monday or
on Mondays and Fridays.
Whatever you
Come
need,
down.
Monday and Friday, come down without an appointment.
Okay?
Okay, that policy isn't gonna change next week, 'cause
As I said, February 4th, that's the policy today.
I don't know what it's gonna take, that's my policy when I'm there, okay?
What?
That's the policy right now. That's where we're running on right now.
Okay,
Okay, well, let's see, it's too late, so maybe Monday.
okay, all right.
Y'all go flood her office Monday. I want like 25 of you down there.
Well, I assume I'm talking about my apartment nurse.
Do what?
I'm assuming that I'm talking about our.
You're talking about the Independent Living Healthcare Coordinator. We're still doing the clinic Monday and Friday, 10 to 12, but no appointment is needed anymore.
This time.
In the clinic.
In the clinic, Monday and Friday, 10 to 12. She is there if you need her any other time, but we have a clinic that runs 2 days a week. Did somebody have a hand up over here? Yes, Gail.
Where is Teresa's office? Where do you have-
Teresa's going to be working in the Independent Living Healthcare office. Mhm. We're just sort of trying to get a little stability in it. We're trying to have a warm body in there. Yes, Gail.
What is the difference between a box by the bed, and they're calling you when you're lying on the floor at 3 p.m., and the pull cord in the bathroom? And the difference about it is, if you push the button on the box by the bed, say you're there, fine. But then, say at 11 a.m., you fall, you can't get up, but if you still push that button, would they know that you were pushing the button on the call box to call for help?
The question was this: what's the difference in the two call boxes? First answer is nothing. If you're in the bathroom and need an emergency call, you hit that. If you're in your bedroom, you hit it. The second call is what if she hits it at 9 a.m. and checks in and says, I'm good, and falls at 11 a.m. Am I repeating that correctly? It is a great question, and you're not going to like the answer. I hope you have a phone within reach, or you can yell really loud. And this is where it sounds like we don't care, and we do. We don't have the manpower or the staff to walk around to every door every day, and even if we did, we'd still have this exact same situation. Anything can happen any day. It can happen at my house. That's why, the pendant, if you were to check in at 9 and you were to fall at 11 and you're wearing a pendant, it's just as simple as pressing a button. That's why we recommend the pendant. Same thing with the wristband. If you fall, you're just pressing a button on the wristband.
But that box has two different buttons. One is a call button at the top, and the other one is the check-in button.
I guess you're hitting the call button for an emergency.
Do you not have visitors every day, Gail?
You're doing great, Gail. But that's why we recommend the pendant and the wristband.
I still don't know where the tunnel is.
Once you find it, you'll never forget it. Once you get down to therapy, whew. In case y'all didn't know, the motto for therapy is what happens in the therapy gym stays in the therapy gym. Any other questions? Yes.
I wasn't going to bring this up.
Okay, then don't. No, I'm just kidding.
And I don't think there's anything that the other guys from here or here have they ran questions by me, and then they said, call 911. I went to Cone Hospital, and they did blood pressure and all the other things pretty quickly within the first hour or two that I was there. And then I was told that I needed to have a chest x-ray. I said, no, I don't. You already know my heart is fine from the previous things that you've done. What I really need, the problem is in my head, and I need a scan, probably a CAT scan. I've had these things before. So anyway, they said, well, you'll have to wait. I waited 10 hours till 4 o'clock in the morning to get my CAT scan. And it showed up a little bit of necessary information, but they released me just at 5:45 in the morning, and I took a cab back to you. So what I'm trying to say is, if someone here in the medicine arena says dial 911, or they dial it for you, in this day and age, you don't know. I was in a waiting room with probably 35 people up until midnight, and then it kind of thinned out. And then they said the longest anyone had ever waited was 8 hours. I topped it. I was there a total of 12 hours. And so I'm just saying to folks who are in a position or need to dial 911, think twice before you do it, or think twice who's authorizing it for you, so you get more immediate attention.
I hear what you're saying. She said, basically, she had to call 911 for some issues she was having per her doctor. She waited 12 hours in the emergency room, and she says, think real hard about before you call 911. However, I'm going to negate a little bit what she said. If you're having issues like that with head issues, heart issues, whatever, and you decide not to call 911 because you don't want to wait, we may find you the next morning, and it may not be how we want to find you. So I know there's long waits in the hospital, but if you are having issues that you feel serious enough that you need care, call 911. What?
Sorry, I just have a question, just for my information. So if somebody falls in their apartment,
Take your mask off.
sorry, if somebody falls in their apartment, what's the procedure? Like,
If you were to fall in your apartment, we're going to hope that you're either wearing a pendant or can get to a button.
all right, I've called
We
somebody. I've
get-
called somebody.
Okay. Public safety has come.
Yes, what
Nurses
are they
come.
doing for me?
They are assessing you.
Okay.
If you have immediate first aid needs, your head is bleeding, they're going to check your
Are they
vitals.
getting me up?
Yes.
And no.
Sorry.
And the reason why.
Oh, yeah.
Yes and no, because you might have hit in your head. We don't know what's going on in the inside of your head.
Okay.
It'll bleed.
And we're
gonna send you out.
There's an assessment done if you're being picked up. If you slid from your chair to the floor, more than likely, we're going to get you up. More than likely. Not a permanent thing.
After assessment.
After an assessment, correct. But I will have to say, someone fell here and had like a slip disc issue. We weren't going to touch that. We can do more damage trying to lift them up. We felt the need was that a paramedic needed to come and have a little better hands-on, the
So
backboard.
Case by case.
It's case by case.
Okay.
Yes. One thing, we have a movie playing here at 3:30, so just go on.
I just wanted to say, yes, but if that person goes to the hospital with the slip disc, how do they get some kind of priority over someone else who can't?
You are talking about the hospital system, and I got no answer for that. I'm sorry. Nancy? Oh yeah, I was supposed to say that too. I told y'all earlier, you're very kind people. If you hear Nancy screaming in her room because she's fallen, and I'm just looking at you, Joyce, you live beside her, and you go, oh, I'm going to go help Nancy and get her up. No, you're not. It's horrible to do. Leave your neighbor in the floor and call for help. I know that's not what's in our brains. Our brains are to help everybody, but you don't know what happened to Nancy. You don't know you could injure her more by helping her get up. And the best part is, you can injure yourself. You could go toppling head over you, and then we come and pick two of you up off the floor. So again, I love that y'all are so good to your neighbors. It's truly heartwarming, but stop. Yes.
Okay, I'm here with my husband, but if I were not here with my husband,
Power of attorney?
Yes.
Power of attorney and all other powers.
Yes. Your emergency contact.
So she can meet me there?
We call the first person on your emergency contact list from that packet.
No choice.
If they don't get that person, do they call the second?
Yes. The question was, if I fall alone in my apartment and am sent out, are they calling my daughter to let her know? We call the first person on your emergency contact list. If they don't answer, we go to the second. If you don't have anybody after that, we'll make contact with them. We'll keep trying. We good? Everybody happy? Thank you all, and feel free anytime to stop by and see me. If I can't answer your question, I'll get it to one of these beautiful ladies that can. And thank you, Therapy, for being here as well. And you guys have a great weekend.